Hi, I'm Dr. Agatha. In this video, I'm going to talk about teeth grinding and night guards to prevent it, and the 5 key things to look out for in your night guard so you don't make your condition worse. And these 5 key things, many dentists don't even know about. These can cause your night guard to make your symptoms worse. So in this video, I'm going to not only show you what those are, I'm also going to share with you how to correct these things so that your night guard not only feels great, but works for you long term. And in addition to those 5 key things, I'm going to give you a bonus tip. For some of you, it can make a huge difference in how the night guard makes you feel and how much it helps or makes things worse. And I would love to hear from you if your night guard has one or more of these things I'm going to show you. So please take a minute to comment below. The first thing to look at in your night guard is whether it's made from a hard or a soft material. So what do I mean by that? Does the night guard bend when you squeeze it? Why is that important? Well, it has to do with whether you grind or clench your teeth. And the type of material your night guard is made from can make your teeth grinding worse. Many people think that teeth grinding is not a big deal. And it may seem like that at the beginning, but I have patients say to me all the time, well, how long am I going to live? So why would this matter? But it does. And you don't know how long you will live. And is this the way you want to spend the last years of your life living without teeth? So at the beginning, you get a little bit of wear. Not a big deal, right? And you get more wear. You still think not a big deal? Or could it be now? It definitely ages you. Then you get severe wear. And to fix this, it would require massive work. Crowns, implants, root canals, tons of money. Then you let it go again, you just get no teeth. What else are you not thinking about? TMD. Some people who grind, actually many, end up having massive pain in the jaw and ear problems. TMD stands for Temporo-Mandibular Joint Disorder. It's a mouthful, right? No pun intended. If you grind your teeth and you don't do anything about it, there's a high chance you will develop jaw pain, headaches. You may already have these and just not even realize they're related to your grinding. Or maybe you have a click in your jaw. Sometimes that's the first thing people notice. But all of these are signs and symptoms of TMD. So if you grind or clench your teeth, it is really important that your night guard is made from a hard acrylic, not soft. And the reason is, if you have a soft guard, you will grind or clench more on it. And that's not what we're trying to do, right? Think about it. If I ask you to hold something hard like a rock between your teeth, are you going to grind or clench on it? No. But what if I put something soft and chewy, like a piece of gum or soft candy? Your teeth automatically go to chew it. Tip number 2. Upper or lower? Is this an upper night guard or a lower night guard? Does it sit on your top teeth or on your bottom teeth? This could actually be quite important for many people who grind and have some TMD symptoms. And this will make a big difference, especially when tied to tip number 5 that I'm going to share with you later on. So hang in there, because this will surprise many of you. Because tons of night guards are made like this, and that's bad for a grinder. So if you're a grinder, and especially if you're beginning to develop some TMD symptoms, you want a lower night guard, but wait till tip number 5, because it will depend on whether or not your night guard also has that part built into it. Tip number 3, even back tooth support. Do your back teeth touch evenly on the night guard? When you put your night guard in and you bite down on it, does it feel like your teeth are touching evenly? So if it's an upper night guard, it'll be the bottom teeth touching. And if it's a lower night guard, it'll be the top teeth touching. Here's how you can check this at home if you're not sure. You can use a thin piece of paper and put it between your teeth and your night guard in different areas on the back and bite down and then tug on the paper. If the paper holds, that means your teeth are touching. If you can pull your paper through, they're not touching. So if you have, say, the right side touching and the left side not touching, then you know that you don't have even back tooth support. We want your back teeth to touch, not the front teeth, just the back. Do they feel pretty even? Compare the right side to the left side. If so, great. If not, if you feel like the one side touches first and the other one less, or they're not even at all, that can cause you to grind on the side where it touches more. And some people will have discomfort or even pain on the side where it doesn't touch. And the reason is that your jaw muscles are going to try and get your teeth to touch. They're going to pull on the side where you don't. And this can cause the jaw to rotate up into your skull, and that can cause pain, ringing in the ear, and many other TMD symptoms. Tip number 4, canine guidance. So this tip is not as critical as the next one I'm going to share with you. The next one is the most important one, especially in someone who already has TMD symptoms. So hang in there with me. The canine guidance is when you slide your jaw to the side. I'm going to show you on the models, so it's easier to see. But when your jaw slides to the side, the only teeth touching or guiding your slide are the canines. These pointy teeth, although they're not always pointy in a grinder, these teeth are supposed to guide your slide, not the other teeth. So check that on each side and see if your night guard has canine guidance on both sides. This isn't as critical in most cases, but if your night guard has it, that's a good thing. And I am going to talk about this in other videos. Okay, we're into tip number 5, no anterior platform. So this is really an important thing in a night guard, especially for a TMD patient. Here's what an anterior platform means. I made this night guard to show you an exaggerated version of an anterior platform because it may be difficult to see, but having this in your night guard is not a good thing. So when you have a night guard in and you go to slide forward like this, the only teeth touching the night guard are the front teeth, like this, and your night guard has an anterior platform. So here you can see that when I slide forward, the only teeth touching are the front teeth, and you can see a big space in the back. And if the platform is small and it's difficult to see, and you're not sure, you can easily check that with paper like this. So if you put the paper in, slide a little bit, and the paper's still tugging, you're good. But if you can pull the paper through in the back, then you don't have contacts. Check back teeth and check the front teeth in sliding motion, and then you know if the front teeth are holding the paper and the back teeth don't, then you have an anterior platform, and that's not good. The reason for this is more complex, and I am doing another video on this topic. So if you want to be notified if that video comes up, subscribe, but for now, this is a really important thing to have in a night guard. So here's your bonus tip: canine guidance or posterior contacts. Here's a challenge for you. You now know that anterior platform is not good. So the opposite is good, right? A posterior platform is good, the back teeth touching. That's a good thing when you slide forward. You also know that if you have canine guidance, that is also good. So what's better to have? A posterior guidance platform or canine guidance? The answer is either one is good, but if you have too much canine guidance, like say your canines are super long and they create a massive space in the back instantly as soon as you slide, that may be too much and need to be reduced a bit. Or if you have the very back teeth touch, like the very back ones, like when you slide forward, you may end up with some muscle tension. So that may also need to be adjusted or reduced a bit. So speak to your dentist about either one of those. I hope these tips help you with your night guard and teeth grinding, and don't forget to subscribe below for more videos like this one. Thanks for watching.